Good morning all. Today I will be presenting on the effect of glaucoma medications on lipid layer thickness in patients with newly diagnosed glaucoma. Coming to the introduction, intraocular pressure is the only modifiable risk factor in patients with glaucoma. Treatment with topical anti-glaucoma medications is essential to prevent the progression of the disease. I think the slides are not running. Okay. However, the long-term use of glaucoma medications has led to ocular surface disease, which is characterized by disruption of the ocular surface integrity, inadequate quantity of tears, and an unstable tear film. LipiView interferometer developed by Tear Science is a new device that can measure lipid layer thickness quantitatively using interferometry. Materials and methods. Patients attending outpatient department of our hospital and who are newly diagnosed with glaucoma and were treated with topical anti-glaucoma medications forms the source of the study. 3 lipid layer thickness parameters, that is maximum, average and the minimum, measured by LipiView were recorded before starting anti-glaucoma medications and after 12 months of treatment. LipiView has an upper cutoff of 100 ICU. Tear film breakup time and Schirmer's values were recorded before starting the treatment. Exclusion criteria being slit lamp evidence of eye surface disorders, current use of contact lenses, patients on topical anti-inflammatory, antibiotic or other medications, ocular surgery or laser treatment, and autoimmune disease. So this is LipiView is a patented technology that measures the lipid layer thickness with nanometer accuracy, captures the blink dynamics such as partial and complete blinks, and images the structure of meibomian gland. This is a real-time visualization of the lipid layer to evaluate dynamic response of lipids to blinking. Coming to the results, 38 eyes of 26 patients were included in this study. The mean age of the subjects was 62 years, ranging from 36 to 72 years, 15 being men and 11 were women. Mean number of medications used was 1.94 and the mean number of total daily eye drops used was 3.15. This is the table showing patients with different types of glaucoma and different class of anti-glaucoma medications prescribed for treating glaucoma. Majority of the patients included in our study were open angle glaucoma and normal tension and ocular hypertension being 4 patients and angle closure glaucoma being 3 patients. So when we have charted the anti-glaucoma medications used, majority of the patients were on prostaglandin analogs, followed by beta blockers, then carbonic anhydrase inhibitors, and then alpha agonists. This is a table showing the lipid layer thickness parameters before treatment and after 12 months in patients on single drug. The maximum, average and the minimum lipid layer thickness parameters before treatment were 80, 64 and 55 respectively. At the end of 12 months, the values have been dropped to 77, 61 and 52. And the p-value was found to be statistically significant, stating that anti-glaucoma medications has an effect on lipid layer thickness. Similarly, in patients who are on double drug, the decrease in lipid layer thickness parameters were found to be significant, stating the same that AGMs have an effect on lipid layer thickness. These are the pictures of right eye and left eye showing lipid layer thickness parameters before the start of anti-glaucoma medications and after 12 months follow-up. The average, maximum and minimum were normal before the treatment, and on 12 months follow-up, all the lipid layer thickness parameters were significantly reduced. Discussion. Longer the duration of topical anti-glaucoma medications and increased number of medications were associated with lower lipid layer thickness. Lee et al. Investigated the effects of topical medications on ocular surface disease and LLT and found that the average LLT in glaucoma group was significantly lower and that one should evaluate ocular surface disease status in patients who are taking anti-glaucoma medications. Arita et al. Demonstrated that the long-term use of topical glaucoma medications was associated with alteration in meibomian gland morphology and function and has contributed to ocular surface disease. Ramley et al. Showed that the prevalence of ocular surface varied from 37 to 91% in glaucoma group and was associated with increasing number of anti-glaucoma medications. So in our current study, anti-glaucoma medications and their duration were associated with lower lipid layer thickness. So there may be a tendency for the patients to have lower adherence to the prescribed treatment. Therefore, assessment and monitoring of LLT changes related to ocular surface disease has a positive effect on treatment adherence and ultimately prevent worsening of glaucoma. Conclusion. Patients on long-term glaucoma medications needs to be assessed for lipid layer thickness to evaluate their ocular surface health. In glaucomatosize, the duration and increased number of topical glaucoma medications were associated with lower lipid layer thickness parameters. Ocular surface disease is strongly related to treatment compliance of topical glaucoma medications. These are my references.
You have to stop actually.
Thank you.
You're overshooting your time. May I have some questions, please, from the panel?
I just asked you one question
Yes.
regarding the double drug medications. Now, are you using as two drugs? Because basically it's related to the preservatives. Now, if you're using a fixed drug combination, so are you using as double drug as being put as two drops, or are you using it as one?
Sir, we are using the single bottle drug, put it like a fixed FDC, sir, actually. In a single bottle, we are having two drugs.
So,
not two
see, basically, ultimately, the ocular surface disorder is because of the preservatives.
Yeah.
And in the fixed dose combination, the preservative is obviously less, but the number of medications is more. But you have basically shown a chart where you've shown the double drug double drug inpatient is using to the effect is more. How do you explain that?
So that's all right. But
Yeah.
we understand that you used it as two medications, isn't it?
Yes, sir. Yes, sir.
Okay.
Sir, actually, in single drug and double drug, actually there was a decrease, sir. But patients who are on double drug, actually, it was still more. The lipid layer thickness was further affected, actually, sir,
Okay.
because there the two drugs are there, and even the preservative also. So it is like almost three components adding to the.
No, actually,
Sir, actually, we didn't do study on the effect of preservative, sir. I had done only on the
Yeah.
drug, sir. So in this study, the drug has an effect on the lipid layer thickness.
basically, I think this is an observation that you have